Namaste, welcome to ayurvedic If you have come to this page means you are really interested in learning Ayurveda dermatology, right? You want to bring happiness into the lives of those patients who are suffering from skin disease. You all know that how bad the patients like psoriasis patients and all suffer from, like social stigma and all, right? You know that, and you want to be a ray of hope in the lives of such patients, right? So before you leave this page, let me tell you something that will surely tell you what mistake you are doing or what is going wrong with your treatment, because of which you may not be getting the successful outcomes. I'm not telling exactly in all cases you may not getting good results. I'm not telling like that, but still this will give you a different approach, different way of thinking into the practice of Ayurveda dermatology. And also keep in mind, we'll discuss one very important case, very important challenging psoriasis case in this video. And it will surely help you to understand my approach and how I teach, how I practice, and all, right? So, myself, Dr. Mahesh Savalagimath. I am practicing Ayurveda Dermatology since 2008, and I did my BMS from KLA Ayurveda College, Belgavi, and post graduation in Agatantra from Vaidyaratnam PS Warrior Ayurveda Mahavidyalaya College, Kottakkal, Kerala. Right. So for my area of interest, I'm practicing only Ayurveda Dermatology, blending Kaichikisa and Agatantra. Right. Teaching is my what you can call, like, I enjoy teaching, and you will see that one. These are my teachers, because of whom I am whatever I am. It's because of their teachings. I'm always working grateful to them, right? It's all because of their teachings I'm here able to stand in front of you or talk to you, right? So when we look into the skin disease, common skin disease, we can put them under three categories: infectious skin disease, allergic skin disease, and autoimmune skin disease. Mostly all skin disease, if we categorize them under, they fall under these categories, like bacterial infections, viral infections, fungal infections, and all molluscum infections or candida infections, like that infections will be there. Allergic are allergic contact dermatitis, irritant contact dermatitis, atopic eczema, so many types of, even why I'm putting irritant contact dermatitis, that is also associated with our immune system only, right? Because of that I have put that under allergic and irritant reaction. Autoimmune diseases, like so many autoimmune skin diseases are there. One of the major is psoriasis, right? You all know that. Now, is there anything common among these three? Is there anything common among these three? The common is immune system, right? Infectious disease dependent on immune system. Allergic and irritant disease dependent on immune system, right? Autoimmune diseases again dependent on immune system. Now it is the time we should change our approach towards looking into the immune system or disturbance in the immune system. So far we have studied, like immunity, immune deficiency, autoimmunity from the angle of medicine, like Kaichik's angle, we can say from the angle of medicine, right? We need to change that approach now. We need to change that approach. Now, we need to consider immunotoxicity. As I told, I belong to Agatantra, so toxicology approach is one of the most important and most practical in present era. Immunotoxicity is nothing but an adverse or inappropriate change in the structure or function of immune system after exposure to exogenous factors, mostly the chemicals, right? Mostly the chemicals. What are the like these exposures? What are these exposures? Like environmental chemicals, like pollutions and all, so many, right? Next come pharmaceuticals, medicines, prescribed medicines, and over-the-counter medicines. All will come. Biological materials, pesticides, fertilizers, agrochemicals, all sorts of, and nanoparticles. All these lead to, and immunotoxicity leads to immunosuppression, hypersensitivity, and autoimmunity. And you know, immunosuppression leads to, makes the person prone to suffer from hypersensitivity, leads to allergic manifestations. Skin is one. Autoimmunity leads to autoimmune disorders like psoriasis. So, base is immunotoxicity, right? Now, when we look into the hetu, etiology of any disease in Ayurveda, mostly 80 to 90% falls under the category of ahar, right? Food related etiology. Now, as we are discussing skin diseases, Viruddhahara is one of the most important one, right? Most important etiology. Now, we'll take two classical examples. We'll try to understand them in the classical way and present scenario. Now, for example, when we look into the etiology of कुष्ठ हेतु जब हम पढ़ते हैं, हमें मिलता है कि मत्स्य दुग्ध or any kind of meat, non-vegetarian food, along with milk, if it is consumed, it is going to act as viruddha, and that leads to skin disease, one of the most important one. Right? This is classical Kaya Chikitsa line of way. Now consider present era. Present day, the aquatic animals come with heavy metals. The meat, other things, they come with medicines, steroids, antibiotic, growth hormones, so many things. And milk and milk products come with adulterants. Right? They come with adulterants. Now think whether this Viruddha is just the same Viruddha explained in classics. Is it the same? You consider fruit and milk. Commonest is banana and milk. As I told, milk comes with adulterants. So many samples, so many national government agencies have done studies. FSSAI has only says that more than 70% of milk in India is adulterated. Not by water only. Many other chemicals are there. Now fruits. Example banana is ripe with कैसे पकाया जाता है banana को? It's ripe using calcium carbide. Most of the fruits are ripe using calcium carbide, and that calcium carbide enters inside the fruit. Now that sanyoga, right? That sanyoga we call it as viruddha, right? It causes a skin disease. Now, is it wise enough to consider this as a general viruddha explained in classics, or we need to think in different way? We need to consider it the Visha Viruddha. It's not just Viruddha explained in classics. It is Sir Visha Viruddha. That you need to keep in mind. Now consider other aspects of the food, vegetables and all. No, we consider like there is no Viruddha at all. The person is consuming normal diet. No Viruddha. Still, our food, our vegetables, fruits, all come with so many chemicals. These all are the articles of standard scientific studies published in daily newspapers and all, to make public aware of such things that are happening with our food. Right? Can see there are coloring agents, there are preservatives, there is rodenticides, so many sites, pesticides, insecticides, herbicides, right? Chemicals that are used, what you can call like additives, coloring agents, flavoring agents, preservatives, all these enter into our food. Still, we do not suffer from immediate diseases or immediate clinical manifestations like Dashagunatmaka Visha. Why? Because these all are low potent poisons, which we call as Dushivisha. What is Dushivisha? Kalantara Prakopivisham, Dushivisha. It do not cause immediate manifestation. It stays in the body over a period of time. It causes clinical manifestations. So what happens? This through ahara, vihara, like occupation, like chemical exposure. For example, the person working. Recently, we had a case. The patient was working in flex industry. That smell. See, gandha is Prithvi Mahavuta. Gandha. We are getting gandha means Prithvi Mahavuta is entering into our nasa. Means chemical is entering into our body. The people working in flex industry or like fertilizer shop or pesticide shop, cement industry, all these are the viharas, which are the stress and all. They make our body less antitoxic. मतलब जो excretion वगैरह होना है उसको prevent करता है. So toxic accumulating in our body. These accumulation lead to dushisha, and dushisha affects Oja. So what we consider Oja? Oja is nothing but immunity. So this dushisha leads to immunotoxicity. Immunotoxicity leads to immunosuppression, hypersensitivity, and autoimmunity. Right? So with this approach, I treat the diseases. So how I approach the skin disease? Usually, I select medicines based on karya and karma. So I select medicines for karma like dushisha or hetu is dushisha. Karya, whatever is the outcome, whether it has caused eczema, psoriasis, acne, herpes, contact dermatitis, allergic footwear dermatitis, whatever it is. So like that. But sometimes what happens, this karma considered dushisha leads to one karya, pathology inside. But that cannot be a independent disease. That serves as a karma for another disease. To simplify it, like dushisha leads to immunosuppression, immunotoxicity. Right? Immunotoxicity, for example, immunotoxicity leads to immunosuppression. Immunosuppression leads to infections. So we need to treat for dushisha, immunosuppression, and infection. Like dushisha leads to hypersensitivity. Hypersensitivity leads to allergy. Like now we need to treat for dushisha, hypersensitivity, and allergic footwear dermatitis. Dushisha leads to autoimmunity. Autoimmunity is not a disease. Autoimmunity will act as a karna and leads to psoriasis. So now we need to treat for dushivisha, autoimmunity, and psoriasis. Right? This is how I approach in treating the skin disease particularly. Now let me allow to introduce my 50 hours course package certificate. It's a certificate course package. The page where you have landed in. Don't leave now. I'll not take much time. But after explaining about the course, we will discuss one very important case. It's one of the most challenging case that I have faced. Psoriasis case, right? So the 50 hours online certificate course package includes 30 hours psoriasis management mastery in Ayurveda and 20 hours dermatology, or we can consider it as dermatological management of dermatological manifestations due to Visha, which we call as dermatology, right? It's actually very price is very high. We'll go into that later, right? Now let us consider what are there in 30 hours psoriasis management mastery. What you will learn actually, you will learn like why to study the psoriasis, what is the scope of this, what is the burden of psoriasis, basics of psoriasis, wherein what is psoriasis, what are the triggers of the psoriasis, how patients suffer, what are the classifications of the psoriasis, different types of psoriasis and all. Then understanding etiopathogenesis of psoriasis. See, etiopathogenesis is not just reading. For me, I consider understanding etiopathogenesis means after reading that we should get some triggers, we should get some idea to plan the treatment. In that way, how we are going to understand etiopathogenesis. Next comes differential diagnosis of psoriasis. Right? We are taking live cases where people fail to or wrongly diagnosed it as psoriasis or wrongly diagnosed it as another disease like that. Then understanding psoriasis in Ayurveda. Ayurveda में क्या consider करते हैं? Some people consider एक कुष्ठा, some consider किटिप कुष्ठा. We consider सिद्ध कुष्ठा. Like that, why it is सिद्ध कुष्ठा, why not kitipa? Why all those things? No, but it's not like you somebody is wrong, somebody is right. It's not about that. How it is going to our diagnosis is going to help our treatment, that is going to determine, right? Based on that, what we are diagnosing that. Next comes Ayurvedic understanding of etiopathogenesis. Now, in this, very important is the modern pathology of psoriasis is interpreted in Ayurvedic term so that we can plan Ayurvedic treatment, right? So that is discussed in that. Next comes clinical assessment of psoriasis like dosha assessment. First, we will discuss how to assess dosha in skin diseases with the cases. Next, clinical assessment of dosha within psoriasis. Like even if we consider Ekakushta, Kiripakushta, Sidmakushta, all are Vatikapaja Kushta. But in clinical practice, we do not get all the psoriasis patients as Vatikapha, right? So if Pitta is dominant, if Vata is dominant, if Kapha is dominant, if Pitta Kapha is there, how to understand that? That assessment is done. Next, before we learn treatment, what we need to be, how we are prepared, how we should be prepared that. Next comes Shodhana in psoriasis, right? In general. Next comes the 5 main important types of presentations that I have come across in my clinical practice. Those will be discussed, like scaling and erythema dominant psoriasis. In that, importance of Shodhana. First is Shodhana. Next comes scaling and erythema dominant psoriasis. Shodhana part 2. In this, you will be learning modified Shodhana. Apart from Nitya Virechana and classical Virechana, we learn some other Virechana, which is very essential in present day, very hectic lifestyle, right? Next comes that same scaling and erythema dominant. If it is Shamana is not needed, Shodhana is not needed, only Shamana we can do. Shodhana with Shodhana, only Shamana, like that it is discussed. Next comes itching dominant psoriasis. Again Shodhana, Shamana. Next is irritation dominant psoriasis. Before understanding irritation dominant, we need to understand what's the difference between irritation and itching. Like if an insect crawls on the body, what we do? We scratch. We call it as itching, right? We call it as itching. If something actually itching is there, then also we scratch. We call it as itching. When patient comes to us, patient will tell scratching. Patient will not tell I am scratching. Patient will tell there is itching. Now, how to differentiate whether it is itching or irritation? Because treatment for both is entirely different. For itching is different, for irritation it is different. So that first difference. Next is how to treat irritation dominant psoriasis. Mostly Shodhana is not needed in that. So that Shamana how approach. Next is hardness dominant psoriasis. How we need to treat hardness dominant psoriasis. Next comes stress dominant psoriasis. Now this stress dominant psoriasis may come with scaling erythema dominance, irritation dominant, itching dominance, hardness dominance, right? Again, stress is there, like that. Next is understanding palmoplantar psoriasis. Palmoplantar psoriasis, modern first we will understand. Next is Ayurvedic understanding of palmoplantar psoriasis. Again, dosha assessment in palmoplantar psoriasis. See, again, Pama Panta psoriasis, if we consider Vipadika Vataka only, again, there also we need to assess dosha. That is dealt there. Next is management of Pama Panta psoriasis as Vipadika and management of Pama Panta psoriasis as Padadari. Next comes management of erythrodermic psoriasis, understanding scalp psoriasis, Ayurvedic management of scalp psoriasis, management of common stage. This is very important, where I told you like prevention of the recurrence. Prevention of the recurrence, all the psoriasis come to one stage where all the clinical presentations will be gone. Means Karya has gone. But Karana, what about the autoimmunity? Whether autoimmunity has gone? No. If you stop treatment again within a month or some time, the patient will again come with the new lesions. So preventing that. So that you will learn in this management of common stage. Next is importance of like administration of Shamana Sneha or Shodhananga Drita, how to select all that. Next is effective selection of external applications, particularly oils, and Patya Patya in skin disease, particularly psoriasis. Patient education, most important, most important. What type of patient education should be there? What should be the doctor's mindset? Mindset of the doctor, what will be the mindset of the patient? Then is clinical case discussion on Kapha Vata dominant psoriasis, clinical case discussion on Pitta Kapha dominant psoriasis, next case discussion on Kapha dominant psoriasis. See, Vata Kapha, now Kapha dominant, Kapha Pitta dominant, right? So clinical discussion on Pitta dominant psoriasis, case discussion on itching dominant psoriasis, discussion on importance of Shamana Sneha with so many cases, cluster of cases are discussed. Next is importance of dosha assessment, how the dosha assessment helps based on that case discussions. Case discussion on five important elements of psoriasis, case discussion on Kobner phenomena, complications, case discussion on like so many case discussions on Vipadika, Padadari. These all will be dealt in 30 hours psoriasis management mastery. Right? So now we'll go to the 20 hours hydrotoxicodermatology. In this, what are discussed? You will learn scope of hydrotoxicodermatology, like role of like agatha based approach in dermatology, we need to learn that one. Then is the contact poisoning, classical things we'll be learning. Next comes danta kastagata visha, like toothbrush paste se hone wala allergy. Uste how we are going to use that in current dermatology. Abhyanga visha, external applications in that cosmetics, everything will come, oil and all. Next comes avalekana visha, comb poisoning means any allergic manifestation of the scalp that will be learned. Mukalepa, all sides of the sorts of cosmetics. Next is Padakavisha, Abharnavisha, contact dermatitis, those things. Contact dermatitis modern, then understanding Ayurvedic understanding of contact dermatitis along with dosha assessment that will be dealt in that. Next will be like case discussion on contact poisoning, like no Padakavisha, Pamopanta psoriasis as contact poisoning, Padakavisha, Vata dominant, gel allergy, gloves allergy induced psoriasis. Next is wristwatch allergy induced Shvitra, hair dye induced Shvitra. Next is Paduka Visha Kapha dominant. Next is Mehendi allergy. Next is photophytodermatitis or phytophotodermatitis or photophytodermatitis like Parthenium allergy. Next, skin diseases due to Dushivisha and Garavisha. How Dushivisha and Garavisha cause skin diseases. In that, we'll be discussing some cases like, chemo complication induced skin disease, Darius disease, Dress syndrome, erythema angularis centrifugum, erythema multiforme with hidradenitis suppurativa. We'll be discussing about food-induced skin allergies. Next, bites and stings induced skin disease, how they present, how to diagnose, all those case-based learning only. Next, in that, Luthavisha, clinical presentations and management, how to diagnose and all. Case presentation on erythema nodosum leprosum. Case discussion on leukocytoclastic vasculitis, as Pitta Next is Pitta like leukocytoclastic. One more case, few more cases we'll discuss. Luthavisha application in Chikitsa, Luthavish like clinical presentations. Ketovish Chikitsa and cellulitis, Ketovish Chikitsa and herpes. All these things are covered in 20 hours hydrotoxicodermatology. Right? Now think about your investment as fees. Whatever investment you are going to make to learn this, about that investment, you think it will be like, the Kantara movie released in 2022. A movie that was made at a budget of 16 crore, made 450 crores. So the investment that you are going to make to learn this course, to join this course, you can get that fees by treating just two or three patients. Remaining everything is your income, and that lasts lifelong and even goes on increasing, right? So the best investment you can make is in yourself. Warren Buffett says. But he says the best investment you can make is in yourself. Benjamin Franklin says an investment in knowledge pays the best interest. Like I told you, right? One or two patients, two or three patients maximum. Your investment has recovered. Remaining everything is income, right? So let us discuss the case. It's one of the most challenging cases that I have treated in my 17 years of experience. Psoriasis case. This is autoimmune disorder, comes with infection also, right? So immune system main, right? Okay. This patient approach is same like Dushivisha. I told you Karana is Dushivisha, Kara is autoimmunity. So autoimmunity serves as Karana and leads to psoriasis as a Kara, right? So on 19/9/2024, this patient went to another doctor, right? A patient, I'll tell you when this patient came to me, right? 27-year-old male patient with psoriasis since 2 to 3 years. Scaling, itching was there was more. And he personal history was like, frequent alcohol, chewing tobacco, and smoking tobacco for 3 4 years. This is the history. This is the presentation on 19/9, right? 19/9 patient came. This is the presentation. You can see that not that severe, not that severe. This is the presentation. The whole body was affected, but not severe. So doctor planned for viragin. So for that purpose, as a Deepanapachana, Chitrakadivati, 2 tablets twice daily it was given 10 minutes before food, and Sura herb oil was given for external application on 19/9. So from 21 to 30, the Shodhana was planned. So from 21 to 26th, Snepana was done, Shodhananga Snepana using Tiktakirta. And from 27 to 29, Abhyanga with Manjistadi Taila and Bhaspasveda was done. After Abhyanga, the patient was prescribed with Siddharthaka Sthana Churna for bath. Sorry, after Abhyanga, the patient was prescribed with Siddharthaka Sthana Churna for bath. He used to apply that and take bath. Right? So complaints gradually aggravated. And the doctor thought it will reduce after giving Virechana. So Virechana was done on 30th September 2024. Abhyanga same Manjista Thailand followed by Swedana and Siddhartha Snana Churna, applying that bath. Then Swadhishta Virechana Churna was given 20 grams and Virechana was given, patient had 10 Vedas. Right? This is the presentation on 39. You can see condition is aggravated. By seeing lesions and all, you can see the patient looks edematous. Patient looks edematous. It is becoming like normal psoriasis, flake psoriasis, or gutted to flake type of psoriasis have converted into erythrodermic type of psoriasis, right? So patient was discharged on first with the medicine like Kamadudarasa, Patolakatunadi, Arigavardhini, Siddharthaka Sanachurna again was given, Sora herb oil, and patient was complaining of like burning sensation. So with that again Swadhishta Churna was Virechana Churna was given for bedtime, and Estimudu was given for extra application. This is on 4. So 10 first, this is 30th like this. This is on 4/10 October. September में ऐसा था, 4 दिन में ऐसा हुआ. Right? This is the presentation. Complaints further aggravated. The patient went back to the doctor and doctor asked to continue the same medicine. Right? So this is 5/10. Actually यहाँ पे oozing है. Actually यहाँ पे oozing है. This video is not playing in this. Actually it is completely oozing. Cellulitis. Complete cellulitis है वहाँ पे. You can see water oozing is there, and patient feared and went to modern hospital, and they asked him to get admitted, and the cost was not bearable for the patient, and then patient came to our right. So on that day, this type of presentation, I prescribed him with Patolakaranadi Kashaya 20 ml thrice daily 1 hour before food, Dashangagada 1 tablet thrice daily after food, and Tripla Kashaya for washing, frequent washing, 2 to 3 times washing. So 7:10 patient came again. We only usually talk to patients. We call the patient, and patient said there is no loose motions, loose stools, because we have given Mrudu Virechana type, right? Pitta Rechan, Patal Katone. So we asked the patient come back, and I gave him Avipati Churna. Addition was that only. So half teaspoon Avipati Churna with the Kashaya. Every time the Kashaya was taken, Patal Katone, that was added into that, and it was taken, and remaining the Shangagada Trifla continued. Next patient came on 14/10, 7 days later. Complaints are gradually reducing. Now oozing is not there. Slight You can see white layers. That is not actually pus. That is dried skin now. Pus sockets were there. That has gone. Dried thin scales are there, like skin. So on 1410, this was the presentation. So what I did, I stopped Avipatti churna. So Patolakatone had 20 ml thrice daily, 1 hour before food. So Avipatti ki jagah pe, what I did, I introduced Guduchari Kashaya 15 ml thrice daily after food. The Shangagada continued, Tripla Kashaya was continued. Now, as you can see, the oozing has reduced, not that sticky. So now, after washing, I gave him Nalpamaradithaila for extra application. Right? This is on 1410. Next patient came on 2310. Now you can see all the oozing, everything has gone. Now it is becoming proper psoriasis. Right? Now it is becoming proper psoriasis. Okay, you can see all the trunk lesions are markedly reduced. So now, Patolakatanadi Gudichadi. Now severity is reduced. I changed that Dashangagada by Dushi Visharagada. And there is no oozing, no stickiness. So no Triflakasha washing. Only oil. This was done on 2310. This is on 2810. Patient came. This is the presentation. Mass reduction is there. Same treatment was continued. Same treatment was continued. Next patient came on 411. Now you can see scaly lesions are there. Slight. But oozing everything has gone. So now Patolakatanadi was continued. But instead of 20 ml, it became 15 ml thrice daily 1 hour before food, and after food I gave him Amrudotar Kashaya, Guduchi Haritiki Shunti, right? 60 ml thrice daily, freshly prepared. So Dushi Vishari ki jagah pe Bilwadi aaya, Alpamradi continued. 1611. This is on 411. 1611, you can see now much more reduction is there. Much more reduction is there. You can see no scaling at all, only like hypopigmented scars are there. So now what I did, I stopped Patolakatanadi. Bilwadi replaced by Dushi Vishari. So Amrudotar Kashaya, Dushi Vishari, Nalpamarad. You can see we are treating for Dushi Visha, we are treating for scaling, and we are now going to start treatment for autoimmunity. Right? This is on 811. 811, this is the presentation. Full all lesions are gone. Now, Gudichadi. Now we are going to treat for autoimmunity, right? So Dushi Visha, we cannot avoid. Everywhere it will be there, so we have to consider to continue Dushi Visha. Right? Manjistadi Taila, instead of scaling and all is not there, right? Only discoloration is there, so Varna is needed, so Manjistadi was introduced. So Gudichadi Churna. This is Rasayana. What it contains? Gudichi Esti. So Gudichi Estimadu is not double. Gudichi Estimadu Jatamamsi Gopshura Churna. This Churna was given 1 teaspoon twice daily on empty stomach. So Gudichari Churna 1 teaspoon twice daily on empty stomach. Dushi Vishari 1 tablet twice daily after food with honey. Manjistadi Thaila for extra application. After this, patient did not come. Actually, we asked the patient to come after 2 months. Patient did not come. But in June 2025, called him just to make sure what is the condition. You can see. Now, patient is not at all taking any medicines for last 5 months. Right? This is the outcome. This is the beauty of Agatantra approach to psoriasis. Right? So, what went wrong in that patient? Why it got aggravated? See, Siddhartha Snanchurna is Tikshna, Ushna, Sukshma, Lekhana type of psoriasis is having cognitive. Friends, when we use such thing, to after Swedana, Abhyanga, then Swedana. Skin has become more sensitive now, and patient has rubbed that all over the body as like soap. So that aggravated. That led to Obner phenomena aggravated. Right? Now what happened? There was burning sensation. And what was needed actually, burning sensation is there. So what was prescribed? Estimadu. Estimadu is good for burning sensation, but it is Shita, Snigdha, Kledakara, Pitta, Vatahara. But Kushta is Kledaja Roga. It's Estimadu is not Kushtagna. So Kushta mein daha hai to Estimadu nahi de sakte. So that increased Kleda. So these two, like triggering Obner phenomena and increasing Kleda, led to the severity of that case. Right? I think you understood what went wrong. Acharya Charaka says, this is because of this only. Acharya Charaka says, Vishag Mumurshur Matiman Ataha Swaguna Sampadihi Param Prayatnam Matistet Pranada Syadhyatana. Even if we have attended thousands of cases, there is always scope, always chance we may go with wrong diagnosis, we may do wrong selection of the medicines and all. So that is why Param prayatnam matistet swaguna sampadihi, for improving the knowledge and skills. Every bishop, every Vaidya, Pranada Vaidya, that is Pranabhisara Vaidya, should always make efforts to improve the knowledge and skills. This is what Acharya Charaka says. And that is what this course is going to give you. That Swaguna Sampatti, improving knowledge and skills. Right? I think you are very much open-minded like me to be a ray of hope for one third of world's population suffering from skin disease. Right? To improve your dermatological skills and knowledge, you are open-minded like me. You are open-minded like me to improve your earning, both dharma and artha. How dharma, I will tell you later. No doubt in that, right? So, how I achieved it? I spent 17 years. I started in 2005, including my post graduation. And whatever command I am having in 23, 24, 20, 25, I spent 17 plus years of hard work, patience, and persistence to achieve this. But if you give me a chance, if you give me a chance, I can take you that this stage where I am today with very easy way, and together we can grow, right? So if you give me a chance, then you can reach here in just 2 to 4 months with very easiest, most easiest journey, right? In mastering management of psoriasis, allergic disease, and all. Allergies in just few months time, right? So that is why this course package is most valuable, available in online platform of Ayurveda, right? See, one important thing, what our learners tell, see what they say. Dr. Rupesh Yadav says that, respected Savalagimath sir, 2% courage was there before joining this. Now he is telling that 110%, right? There is one more person who gives, they all are talking about how important it was joining this course, how it has changed their clinical practice, how it has changed their approach, how the patients are respecting now them, how they are getting respected in the society, how much they are earning, everything they are telling. In our WhatsApp group, they even share cases. Every now and then they discuss the cases. Like today, my patient came with this type of improvement. They are ready to know. They are ready to present their cases. Such type they are treating the patients, and even they are preventing the recurrence, right? See, many people have asked me to create courses on others, other skin diseases, that I'm preparing on that, right? So this is the, what you can call, our learners, what they tell about this course. So what are the benefits? You will 100% master successful Ayurvedic management of psoriasis, dermatitis, and allergic skin diseases in just few months of time without compromising your daily routine activities. Just by investing maximum 2 hours a day, you invest in the course, right? You spend, you watch. It's lifetime access you have. Anytime for long you can watch them. There's no time restriction. Daily 2 hours only you watch, right? At your own place, your own time, your own pace. वापस भी देख सकते हैं आप पीछे जाके, right? Very important is more than 30 who were practicing BMS doctors practicing modern medicine now completely switched to Ayurveda practice, and now they are practicing only Ayurveda dermatology after joining this 50 years course package, right? You will be able to treat at least 8 out of 10 psoriasis patients successfully, like with 80% success rate, I'm telling you, right? And even prevent the recurrence of psoriasis for 5 years, 6 years, 10 years, and even more. And that is a promise. That is the promise. You can charge high. When you can give better results in short time, you can charge high. In case of difficulties, I do hand holding. If you face any difficulty in treating your cases, I will help you to treat that patient, right? And there will be, as sometimes you may feel like, oh, ये recorded है तो live sessions होता तो अच्छा. Live sessions are many times not good for you also, right? You may be attending OPD, you have exams, you have class and all, right? So there will be periodic live sessions where question answers will be there. Your all questions, like every video comes with comment section. In comment section, whatever questions you have, you share, that comes to me. We discuss on that in live sessions. Or you can share your questions in the group. Instantly, you can get the answer. Or you can personally WhatsApp me can call me, you will get instant reply, instant answer, right? This all you will get in this course, right? So invest better, grow brighter. Invest your little time, very little money, in this course package and become an expert in Ayurvedic management of psoriasis, dermatitis, and many allergic skin diseases. And this investment will grow as per your will and wish, right? So don't waste the opportunity. Join our 50 hours online certificate course on Ayurvedic dermatology, which includes 30 hours psoriasis management mastery in Ayurveda and 20 hours Ayurvedic toxical dermatology. You will get lifetime access, right? So how can you access our course? You can access our course on Android app. Right now we have only Android app. If you are using iPhone, then you can go with web browser also. Both are very friendly. There is no glitches and all in our app, and even web through also. No problem. And anytime if you have any issue, you can directly contact. No problem, right? So I told you how we are going to gain dharma, right? This is what Rasarna says about treating skin disease. What he says, Rasarna text says, कन्याकोटि प्रदानेन गंगायां पितृतर्पणे विश्वेश्वर पुरिवासे तत्फलम कुष्ठनाशने. 1 crore कन्यादान करने के बाद में what dharma, righteousness, पुण्य you gain, that you gain by treating one कुष्ठ patient. गंगा में पितृतर्पण देने से what पुण्य you gain, that you gain by treating one skin patient. विश्वेश्वर पुरिवासे, काशी विश्वनाथ के सन्निधि में बैठ के जप तप होम किए तो जो पुण्य मिलता है, that you get by treating one कुष्ठ patient. गवाम कोटि प्रदानेन च अश्वमेधशतेन च पुरुषोत्सर्गे च यत् पुण्यम तत्पुराय कुष्ठनाशिने. सो मच इज एक्सप्लेन. 1 crore गोदान करने से जो पुण्य मिलता है, अश्वमेध याग करने से जो पुण्य मिलता है, these all are explained as the benefits of practicing dermatology, right? So get both dharma and artha. Join our course and grow with us. Thank you for watching. Welcome to once again, welcome to ayurvedic skills.com. Namaste.